The kidneys are seated in the retroperitoneum, one at each side of the vertebral column, next to the liver and the spleen. They are normally located between the transverse processes of thoracic vertebra 12 and lumbar vertebra 3. The left kidney is typically more cranial in its position than the right one. The cranial poles of the kidneys are normally orientated more medially and posteriorly than the caudal poles. To have a better understanding for the topography of the kidneys, especially in ultrasound, it is useful to take a thorough look at the neighboring organs. Now we are going to view these features on our anatomical model. We remember the kidneys are hidden in the retroperitoneal space. The left kidney over here, the right kidney over here. And we can easily see that the aorta is near the left kidney, the IVC near the right kidney. And these two caps over here are the left adrenal gland and the right adrenal gland. And we can also see the psoas muscle here on both sides, where the kidneys slide up and down with a breathing movement. Another neighboring organ is the liver with the gallbladder. We can see in a normal position, the liver is near the right kidney, and also the gallbladder is an adjacent structure. Now let's take a look at the kidneys from the dorsal side. Here we can see how close the kidneys are situated to the big vessels, the aorta over here and the IVC on the right side. We can clearly see the urethra forming out of the renal pelvis on the left side and on the right side, and we can also display the spleen near the left kidney over here. The kidneys consist of a renal parenchyma over here and the renal pelvis. In the parenchyma we can distinguish the renal cortex at the outside and the mark pyramids over here. In the center we find the collecting system of the kidney with its minor and major calyces and the renal pelvis in the center. From here the urine passes through the ureteropelvic junction into the ureter. The renal artery enters the kidney through the hilum and branches off into segmental arteries, further into interlobar arteries and into arcuate arteries, over here. The renal veins drain the blood of the kidney in a similar way and collect in the renal vein, which leaves the kidney through the renal hilum, over here, and is positioned anterior to the renal artery. Did you know that the kidneys receive about 20% of cardiac output? Amazing, isn't it? Such small organs weighing about 130 to 150 grams and getting such a lot of blood supply. Now that we took a thorough look at the anatomic features of the kidneys, we want to go and see how we can image the kidneys in ultrasound. For scanning the kidneys, we need again our curved array transducer. Fasting of the patient is not necessary. And we can examine the patient either in a supine position for both kidneys or also in a prone position. But most often we use a left lateral position for the right kidney and a right lateral position for the left kidney. When we perform ultrasound of the kidneys, what is it that we want to look for? What are the real important assessments? We want to evaluate the form and the size of the kidneys, their position, and we also need to take a look at the capsular contour. We want to assess the renal pelvis and, of course, the renal parenchyma. A normal kidney has an oval or more bean-shaped form and has a diameter of 10 to 12 centimeters in length. The capsule is clearly visible and has a smooth contour. Both kidneys slide up and down on the psoas muscle when the patient is breathing. This is a normal finding. A lack of displaceability in comparison with the psoas muscle can be a hint for a paranephritic abscess or infiltration of the kidney by a retroperitoneal tumor. The renal pelvis is bright and hyperechoic in ultrasound and should show no dilatation. A dilated renal pelvis would be anechoic in the center because of the congestion of urine in the pelvis. The renal parenchyma shows a differentiation of the cortex and the mark pyramids, especially in younger people. The mark pyramids are more hypoechoic than the cortex. In older patients, this difference can also be absent, and the whole renal parenchyma has the same echogenicity. A healthy kidney, of course, shows no tumors or masses, and the parenchyma, when measured, shows more than 30 millimeters in diameter. Our approaches are again longitudinal and transverse approaches for both kidneys, as we scan the organs always in at least 2 planes.